CNA Paraphimosis Prevention. Welcome to the quiz. Question 1. A resident is in the bathroom and calls out for help because they are feeling dizzy. Upon entering, you see they are still seated on the toilet. What is the first thing you should do? Option A. Run and get a blood pressure cuff and stethoscope to check their vital signs. Option B. Hand them a cold washcloth for their forehead and tell them to put their head between their knees. Option C. Stay with them, check their color and orientation, and call for assistance using the call light. Do not leave them alone. Assess if they feel faint or nauseous. Option D. Help them stand up immediately to get them back to bed before they fall. The answer is C. Never leave a dizzy resident alone. Stay and call for help. Option A is incorrect because leaving to get equipment leaves them unattended. Option B is incorrect because head between knees may not be appropriate and you shouldn't leave. Option C is correct because you should not leave a dizzy resident alone. Option D is incorrect because standing could cause fainting. Question 2. A resident's family member brings in a favorite food for the resident that is not on the prescribed diet, e.g., a bag of salty potato chips for a resident with CHF on a low-sodium diet. What should you do? Option A. Politely explain the resident's dietary restrictions to the family member, thanking them for their thoughtfulness. Suggest they speak with the nurse or dietitian about appropriate treats that are within the resident's diet order. Option B. Take the food and throw it away when the family leaves to protect the resident's health. Option C. Let the resident have the food, as it's a special treat from family and will boost their morale. Option D. Tell the family member they are not allowed to bring in any outside food under any circumstances. The answer is A. Educating the family respectfully and offering alternatives is the best approach. Option A is correct because it educates the family while being respectful and offers a solution. Option B is incorrect because throwing away food is disrespectful and may damage trust. Option C is incorrect because allowing it could harm the resident's health. Option D is incorrect because a blanket ban is not helpful and may alienate family. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. Which of the following is an example of proper body mechanics when lifting a heavy box off the floor? Option A. Squat down, keeping your back straight and your feet shoulder-width apart, and lift with your strong leg muscles as you stand up. Option B. Bend at the waist, keeping your legs straight, and lift with your back muscles. Option C. Lift the box as quickly as possible to minimize the time you are in a bent position. Option D. Twist your body while lifting to get better leverage and avoid straining your back. The answer is A. Squatting with a straight back uses leg muscles and prevents injury. Option A is correct because it uses leg muscles and keeps the back straight, preventing injury. Option B is incorrect because bending at the waist strains the back. Option C is incorrect because speed doesn't prevent injury. Option D is incorrect because twisting can cause injury. Question 4. A resident who is depressed refuses to get out of bed and participate in activities. What is the most helpful approach? Option A. Sit with them for a few minutes, gently encourage them, and perhaps offer a simpler, one-on-one activity in their room, like looking at a photo album together or listening to music. Acknowledge their feelings and offer a small, achievable connection. Option B. Leave them alone, as they have a right to refuse and forcing them will only make it worse. Option C. Force them to get up and go to the activity room, explaining that socialization will help their depression. Option D. Tell them that lying in bed all day will only make them feel worse, so they should make an effort to get up. The answer is A. Gentle encouragement and low-pressure activities are helpful for depression. Option A is correct because it offers gentle encouragement and a low-pressure activity, which can help without overwhelming. Option B is incorrect because isolation may worsen depression. Option C is incorrect because forcing can increase resistance. Option D is incorrect because telling them they'll feel worse is not helpful and may increase guilt. Question 5. A resident has a hearing aid that is whistling or producing feedback. What is the most common cause of this? Option A. The battery is dead and needs to be replaced. Option B. The ear mold is not inserted properly into the ear canal, or there is a buildup of earwax blocking the sound. Removing and reinserting it correctly often solves the issue. Option C. The volume is turned up too high for the environment. Option D. The hearing aid is broken and needs to be sent out for repair. The answer is B. Feedback usually occurs due to improper fit or wax blockage. Option A is incorrect because a dead battery causes no sound. Option B is correct because feedback usually occurs when sound leaks out due to improper fit or wax blockage. Option C is possible but less common. Option D is possible but not most common. Question 6. A resident asks you to read their personal mail to them. What should you do? Option A. Read the mail, but then share the interesting contents with other staff members during lunch. Option B. Read the mail aloud, as you are assisting a resident with a need they cannot meet independently. You must maintain the strict confidentiality of the contents and not discuss them with anyone else. Option C. Tell them you are too busy and to ask a family member or volunteer to do it. Option D. Refuse, as reading someone's personal mail is a violation of their privacy, even if they ask you to. The answer is B. Assisting with reading is part of care, and confidentiality must be maintained. Option A is incorrect because sharing violates privacy. Option B is correct because assisting with reading is part of care, and confidentiality must be maintained. Option C is incorrect because refusing without reason is not helpful. Option D is incorrect because reading with permission is not a violation. Great job! Don't forget to subscribe. Bye!